My dear friends and colleagues, I come to Hyderabad in the year 1978 to join BDS because that was a combined state and that was the only college available then. And completed my BDS in 1983. Then that time we were not knowing what to do next, and even internship was not compulsory then. So we were looking for a small job or anything, and then I landed up in Pondicherry in Jipmar as a junior resident, that is equivalent to senior house job. Then we used to have only 4 seats, one subject, 1 seat only. So for the 4 seats, I was struggling for almost 3 years. Then again I came back to Hyderabad in 1987, completed my degree in orthodontics because that time whoever got the first, they used to join ortho. That was the time in the 80s. So I used to stay first at that time. So I joined, obviously those days or next 1 decade everyone was joining only orthodontia there. So immediately after completing, then I started my practice in 91 in Himayat Nagar. Even now also I am practicing there. Why I am telling you this is just we are going back 3 decades behind, almost 4 decades I should say. 78 is 22 plus 22, 44 years back. So those days when I joined BDS, a lot of people used to ask me, what is BDS? Is there something different? Initially I joined veterinary and I came from veterinary to dental. People used to laugh at me, why did you leave veterinary and why did you come, why are you joining this BDS? What is this BDS? Nothing, they told me you're going to regret. I never regretted. I'm glad and happy that I came here and I have done my best, and I've been doing what I used to do even 30 years back. Even today I'm doing the same thing, except that maybe I may not be updated as much as you, but still whatever the principles or whatever the treatment that we used to do, we still do. And that's the reason why I did not get opportunity or I did not get chance to get out of that phase, and I was getting the second generation patients now. And my daughter also, she completed her BDS and she just gone to further studies to abroad. And after finishing my MDS, somehow those days all the idea activities used to be only in a GDCH, in the government dental college or hospital, because the number was so small, and whatever the number we were getting only in the dental college. So for every small program or a big program, it has to be care of adults GDCH. But later things have changed, and I became IDA State Secretary in 1992, immediately after my post-graduation, and I was even President-elect in 93. Then I became President of IDA Deccan Branch twice. It was the late 90s and early 2000. Then slowly I had to go to my specialty, and we have conducted a national conference in Hyderabad, Orthodontic Conference, 50th Indian Orthodontic Conference in Hyderabad. The next year I became the President of Indian Orthodontic Society. Those days, before the private colleges or so many educational institutions have not come, the number used to be very, very small. For everything, we used to literally beg and we used to request everyone, please, you take up this job. And not like probably nowadays there are a lot of people who are very into and they want to serve and they want to do real service. But those days we used to literally beg and request them or sometimes bribe them and please take up and move forward. So it started, the Deccan Branch started in the dental college itself those days. Later, thanks to people like Sekhar, who has been like a one-man army. He has been maintaining, and now the army has become probably 10 or 15. And and I am proud to say that I am a member of Deccan Branch, and I was initially we were some of the people who have directly become members, permanent members, and the programs. There is a regular continuity of the program. Those days it never used to be like that. Things have changed. You people are very lucky that you are this generation. We are also happy and see that from that generation to this generation we are still seeing, and I'm sure all you guys will definitely make the association even bigger and stronger. And thanks to the technology and thanks to the facilities, thanks to the pharmaceutical companies and the sponsors and all these things, this is going on. It has become a regular feature, and you people have been very lucky to have an organization like this, and I wish all the best to every one of you, and thank you very much for giving me this honor, and thank you, appreciate this. Literally, I really felt that you making me very old. Probably, I may not look that old, but I'm only 61 years. So thank you, Sekhar, thank you, Karnataka, thank you, Ramadi, thank you everyone, thank you very much.